Hi, my name is Llanos. I'm going to talk about the factors associated with Carious lesions among young children. Definition. Tooth decay in young children occur when bacteria in the mouth begin to eat away at baby teeth, also called primary teeth. Tooth decay is also known as a cavity. The factors associated with the presence of caries are period of formal education of the father, of both parents equal of inferior to 8 years old, high sugar consumption, presence of visible bacterial plaque on the buccal surface of the upper incisors, and bottle feeding associated with clipping.
With a third of North Carolina kids entering kindergarten with tooth decay, it's vital to get a message of good dental health to parents.
I think for us, the biggest problem is parents don't have a lot of time to communicate with us. And so what happens is only one side gets to say what they really need to say.
Very good.
The 6-year Zoe initiative, Zero Out Early Childhood Tooth Decay, evaluated the impact of preventive dental activities in North Carolina medical offices and early Head Start centers on childhood tooth decay. More than 400 North Carolina teachers and staff in 25 early Head Start programs in 41 counties were trained in basic oral health strategies and encouraged to link kids with doctors providing preventive dental services, such as dental screenings and fluoride varnish application as part of well child visits. To help teachers share these strategies with parents, Zoe provided motivational interviewing training, a new collaborative way of communicating. 176 staff from the early Head Start programs participated in the training. Results showed improved knowledge and ability to respond to a problem situation in an MI-compliant way. Preliminary results from the Zoe project show families with children in early Head Start programs had significantly better oral health-related quality of life than families who did not participate in these programs. They were more likely to have a dental home and more likely to visit a dentist. Bottom line, Zoe found that more than 90% of targeted children used preventive services in the first 3 years of life, a critical time for child development.
Good communication is when you can just tell that families are connecting with you. They hear, they're excited, they're willing to make a plan, and you see real change happening in the family.
Application in dentistry. In dentistry, tooth decay at an early age is very common today. The treatment often good results if they are treated in time. Prevention is the first option to avoid tooth loss. We can apply sealants of pit and fissures. If the Carious process already active, we must carry out direct restoration. Other treatment options we have preventive talk on oral hygiene to parents and fluoride application twice a year.
Welcome to this Pediatric Clinical Skills video for placement of a fissure sealant. We will focus on the practicalities of application in this video, so please see other educational material for background reading. Fissure sealants can be very technique sensitive, and good moisture control is a key factor in their success. Adjuncts for tooth isolation and moisture control are shown here. The most common isolation method is to place 2 cotton rolls in the buccal and lingual sulci. Dry tips can also be placed in the buccal mucosa to aid moisture control. If you are undertaking a restoration on another tooth in the quadrant, the rubber dam can be utilised for fissure sealant isolation too. However, it's not usual to undertake local anaesthetic and place a rubber dam when completing fissure sealants alone. Using a tooth model, the tell, show, do behavioural technique can help to improve child cooperation. You can use words like tooth shampoo instead of etch, as this can aid child understanding. It is also advisable to warn the patient that the tooth shampoo tastes very sour. Remove soft plaque deposits with the slow speed brush. Do not use very gritty pumice, as this can be retained in the fissures and affect the sealant's bond to the tooth. 37% phosphoric acid is used to etch the tooth. Cover the occlusal, buccal and palatal or lingual fissures, but ensure to keep the etch away from any soft tissues. Leave the etch for 20 to 30 seconds. Wash and gently air dry. There is some evidence to show that bonding improves retention in the short term. We are demonstrating bonding a fissure sealant here in case you wish to do so. You can place the sealant using a thymazine probe or small spoon excavator. Scoop a small amount of unfilled resin onto the tip of the instrument and place along the length of each fissure. Ensure to seal the buccal and palatal fissures also. Then light cure for 30 seconds. Evaluation of the sealant is extremely important. Check for looser overhanging areas with a probe. Use a probe to check for ledges of excess resin. The fissure sealant should not be easily displaced from the tooth and there should be no air bubbles. Pay particular attention to any overhanging areas. It is advisable to warn the patient that the sealant may feel high in the bite initially, but will adjust after a couple of weeks.
Pros and cons. Children should improve their diet to avoid health and oral problems. The habit of going to the dentist from an early age is created in this way to prevent future disease. Losing teeth at an early age causes future severe malocclusion in children, and children suffering from dental cavities create the habit of fear towards the dentist due to pain caused by not treating them on time.
So we have Bronte here today, who's 3 years old, who's come in for her checkup. She comes in every year, which is great. So we're going to check your teeth today, Bronte. Big smile for me. Wow, like a tiger. Good job. We can see nice, healthy gums. Beautiful, clean teeth. Really big for me. Really big. Good girl. You're doing great. You've got all your baby teeth. Well done. So when we're helping kids brush their teeth, we want to make sure we clean right along the gums where pink meets white, using small little circles and fluoridated toothpaste. And we encourage kids that are old enough to spit out and don't rinse. And it's always good to offer tap water as well with every meal. It also contains fluoride and it keeps our teeth super strong, doesn't it, Bronte? Yes? Good girl, you're doing so great. Aww. You want a big hug? Oh, good girl. Right, let me have a go. Ready? You pull the lip down, small little circles. Where pink meets white. Good girl, Bronte, you're doing so well sitting so still. Keeping your teeth super clean. And then we go to the top. And we lift the lip. So it's always good to check the teeth for any white spots. They're generally the first sign of decay. If you do notice any white spots, give us a ring and come in for a checkup. And start the other side. Good girl. Casey, thank you for bringing Bronte in today. She did great for her checkup. Her teeth are all clean and healthy. So just a few tips with brushing. Make sure you help her until the age of 8 and keep encouraging fluoridated toothpaste. With snacks, avoid any sugary and sticky snacks and drinks and always choose tap water. And please bring her in twice a year for a checkup. You've done a great job today.
Wonderful.
Thank you.
Good job, Bob.
Issue apply in Ecuador. In Ecuador, the Minister of Public Health, Carious, door-to-door campaign for fluoridation in rural areas for children and also in the different health centers. Nationwide dental care and prevention talks are offered for parents and their children on issues related to oral disease. In conclusion, dental cavities in children are very dangerous since they can cause future problems in their mouth. Misinformation in parents, dietary habits remain the main cause of Carious lesions, and the present type of visible bacterial plaque on the buccal surface of the upper incisors must be considered an important clinical indicator, often associated with inadequate dietary and oral hygienic habits. Thank you.